Hello, my name's Jacob. Today I'm going to be doing my immediate care of a newborn using my GPSPs. I've already performed hand hygiene. I've entered the room, been given the newborn, turned on the warmer. I'm going to go ahead and turn the baby over on its side. I'm going to suction the baby's mouth out, suction each nostril out. I'm going to turn the baby back over. I'm going to dry the baby off to stimulate crying. I'm then going to pick the baby up, change out the wet linens. Once I've done that, I'm going to lay the baby back down, and I'm going to do my APGAR. You're going to do your APGAR at 1 minute and 5 minutes after birth. I'm going to start my APGAR by listening to the apical pulse for 1 full minute. Once I've done that, I'm going to assess the respiratory effort. It's even and unlabored. I'm going to assess the muscle tone. It's good. It's not stiff. It's not flaccid. Baby's moving around well. I'm going to assess the baby's color. Color's good. It's pink. I assess the baby's reflex by suctioning out the baby's mouth and a grimace, but I can also assess it by flicking the baby's foot, and it reacts. I'm then going to move into the umbilical cord. I'm going to assess the umbilical cord for any bleeding. There is no bleeding. I'm going to assess that it has all of the vessels. There's 3 vessels. There's 2 arteries and 1 vein. So we're good there. Then I'm going to move into my vital signs. I'm going to get a BP with the appropriate blood pressure cuff on the arm and opposite leg. Once I get it and it's good, I'm then going to assess the respiratory rate again, and it's even and unlabored. I'm going to assess the apical pulse again, and it's good. Then I'm going to get a axillary tip, and we're good there. I'm then going to assess my baby for symmetry, making sure that it has all 10 toes, all 10 fingers, making sure that everything is good and symmetrical, and we're good there. I'm then going to sit my baby up and assess my baby's posterior and anterior fontanelles, and for any cephalomatomas, and we're good there. I'm then going to lay my baby back down. Once all of that is good, I'm going to go ahead and get my baby's weight. I'll pick my baby up, take it over to the scale, zero out my scale, lay the baby down on the scale, keeping my hand above the baby at all times since it's an open scale. Once I get my weight, I'm going to pick the baby back up and put it back in the container. I'm going to assess 3 reflexes. I'm going to do the brooding reflex where I rub the baby's cheek and it will turn its head towards me. I'm then going to stick the tip of my finger in its mouth and it will suck on my finger for the suckling reflex, and then I will put my finger in its palm for the palmar reflex, and it'll make a C around my finger, and all of those are good. At that point, I can go ahead and identify baby and mom, with two bracelets for baby and one for mom. That way, if they get separated, we know that baby's going back to the correct mom. Go ahead and get the correct needed prints, and then at that point, I can go ahead and get 2 moist cotton balls, cleaning from inside out, disposing of, inside out, disposing of, and then getting my preventative eye medicine in the conjunctival sac, going from the inside out, and a ribbon on both sides, making sure not to touch the eyelid, disposing of that, and then at that point, I'm going to administer a vitamin K shot. I'm going to identify the vastus lateralis. I'm going to stabilize the leg, clean the spot with an alcohol wipe. I'm going to get my shot. I'm going to administer it, engage the safety, and put it in the sharps container. At this point, I'm then going to put my baby's hat on. You don't have to, but since the baby does lose its heat through its head, I'm going to go ahead and put a hat on, even though it's under its warmer. And I'm going to go ahead and put a diaper on. At this point, you can go ahead and wrap the baby up, or you can just leave them as they are. Since they're in there warmer, I'm going to go ahead and clean up all of my supplies. Make sure that the baby is safe. Take off my gloves. Perform hand hygiene. Document report.